Yeah, there are still a few seats available up front if you want to sit down. Thank you. Great. So good afternoon, everyone. My name is Claude Brûlé. I'm the Senior Vice President Academic, and it's my pleasure to be your MC and to welcome you to our Algonquin College Healthy Living Education Information Session. First of all, wow, what a great turnout. This is not what I was expecting. So I really thank you for being here this afternoon. And let's have a round of applause for all of our exhibitors. It's amazing what food will do. But seriously, you were all here to get your pressure taken, weren't you? Right. If you're like me, I was asking, I said, I just came from a meeting. I'm not sure you want to take my pressure right now. We'll check after this session here. But in seriousness, being healthy, feeling healthy is more than just the absence of disease. Can we agree on that? I mean, sometimes, we feel we have a little boo-boo, but we otherwise feel healthy, right? And so some of what we're trying to do through this exhibit, through progressing through this very large initiative, is to shift the conversation and help with the transformation of our health and wellness in the province, in fact, in the country, by talking about what it means to be healthy, what it means to be well, what it means to be happy. And you have a great demonstration here today of what our future vision is for our college and for our community. We're not going to do this every day, but you have an idea of what clustering all of these services and all of these attributes under one roof can do. And the purpose of today's event is to showcase what we've already achieved in this space. Those demonstrations that you see here, the learning enterprises that we already have in place, whether it's the dental, the massage area, the spa area, and our Restaurant International, all of these and more are example of learning enterprises, workplaces that we've created to continue to simulate learning in a very applied manner. And you'll hear more about this from President Jensen and from our two speakers, Dr. Barb Fold and Mr. Jim Kite. They will present to you what we presented to the board last night, and they will convey to you what comments we've received from the board, the great accolades and endorsement that we've received from the board. This is not new. We've been on this road for some time. For those of you who have been here long enough, as I have, we started talking about this conversation even in the days when we started ACE around expanding the college offering. And as late as what we responded to the ministry in terms of differentiation for the college, in terms of what constitutes areas of strength, an area of growth, health and wellness was front and center. And this vision that we'll be explaining to you today is a continuation of that initiative and that transformation that we want to bring about. So without further ado, I will call upon our president, Cheryl Jensen, to give you a few opening remarks. Cheryl.
Well, hi, everyone. Wow, what a gathering we have here today, but for such an important initiative. And I'm certainly not going to steal the thunder of the presenters, Barb and Jim. I will tell you, though, that last night at the board meeting, well, first of all, at the board meeting, to see how everything that we've been working on, as Claude said, for a long, long time, but certainly this last year with a focus, a real intentional focus on this initiative, and our space planning that John and Phil presented to the board. You know, you couldn't help but feel so proud of what we're doing here at Algonquin College, and I think the board was extremely impressed with the, first of all, the level of activity, but the innovation, the spirit of really being at the forefront and leapfrogging other institutions, taking issues like the fact that we all know funding to healthcare is changing. Money is going from hospitals into communities. That every CEO that I've met with in Ottawa talks about that. The fact that we're all getting older. Well, some of us maybe not, but most of us are admitting that we're getting older, and that population is growing. And how does healthcare and education change to serve that community? I talked to Alex Munter, and he's saying that money is coming out of the children's hospitals, and that's because of our aging population. So that's something that the healthcare is dealing with. How do we then, as educators and as community leaders, provide that next phase, that next level of health prevention, of disease prevention, of health promotion and health care? Well, in true Algonquin spirit, we've got a model that I think is going to be looked upon as one that can be replicated across Ontario and certainly across Canada. Premier Wynne has started some advisory hubs within the province on dealing with these issues and finding these new methods. And Jack Kitts and I are meeting with Bob Shirley tomorrow morning to say, how can we then in Ottawa choose us as a location that will be a model for the rest of the province. So. And you know, we've got great pictures of buildings here, and they're very exciting and modern and exactly what we need, because space matters. The way that we configure our space matters, not just to our students, importantly to our students and what they're attracted to our buildings, but it matters on how we interact with our communities and how we provide this new type of service and intervention to the community. So we'll have a great building for us to talk to the province about, talk to the feds about. You know, they always like to have shovel-ready projects. Well, this would be one of them. But it also is just, I think, an icon into the future of healthcare and how healthcare and education will be merging in the future. So I can't say it as well as Jim and Barb can, so let's sit back and have the experts tell us all about it. Thanks for being here.
Afternoon, everyone, and my excitement is just overflowing. It just has been a very exciting 24 hours for me personally, and as many of you know, this has been something, it's been a dream, and that I've had for a considerable period of time. And so to see some of the pieces coming together in the way they have, and the enthusiasm in this room and in the room last night was just a tremendous. Left a tremendous impression on me, so I'll have to bring myself down at some point. So, but anyway, I'm just absolutely delighted to walk you through some of the presentation. And my colleague Jim is with me today, and it's important that we talk about how we've done this together as two schools, and in fact, it's more than two schools. It's a whole community here that has worked on this. Every faculty, the senior leadership, we've connected with this to say, yeah, this is important. Our health and well-being is important to us, and how can we all contribute to that? So even though the two of us are standing here today, it's really important for us to understand that it's everyone that's part and parcel of this. And Cheryl's, referred to the changing landscape. And we pick up so much today, and we read about the changing landscape and what's happening in our community. I just want to share with you a couple of the key imperatives that we're seeing that's helping to inform what we're doing. And if I look at the community imperative and we look around us, in Ottawa, The demographic in this particular city certainly mirrors the demographic that's happening across the country with the number of seniors that are in our community, and those seniors are going to increase as the years go on. And what does that mean to us as a community? What kind of supports do they need to be there in the community? And I know several years ago we did some investigations around this particular Capital Ward in the Bay community, and the number of folks that perhaps were living in poverty, young people who didn't have the supports that they needed, and seniors, again, who are struggling. So there's a community imperative that, thinking of our mandate as a community college, that's so important to all of us. The government imperatives, again, I think I'm probably speaking to the converted and the things that you've read recently. One that particularly resonated with me was a report by Gail Donner and some colleagues that was commissioned by the government called Bringing Care Home. And they went out to folks in the community and families and with the resounding response of, we want to be cared for in our homes, in our communities, with the right care provider at the right time and the right place. And it was so meaningful for them. And there's a series of recommendations that come out of that. And the Minister Hopkins in February updated the Ontario Action Plan that again is talking about bringing things back to the communities, the integration and the coordination of care, thinking about how we can create those community hubs where people can receive the services that are so important. And of course, our local integrated health network has developed their strategic plan around those similar pillars. So there's a government imperative that's certainly complementing the community imperative. And and my colleagues have had a most interesting 4 months, and we've connected with our community. And we weren't out to sell our vision. We were out to listen. We were speaking with all of these folks and several more to be able to say, what's happening in your world? What's your strategic direction? Where are your resources? Where are you placing your resources in the next several years? And listening to those conversations and having the opportunity to see how those connect with our thinking. Resoundingly, the enthusiasm and the promise of folks that we met over 4 months to say, Algonquin, you're doing this right. This is timely. How can we be part of that? So whether it's Briere saying, we'd like to have an adult day program on site at Algonquin, whether it's Pearlie Rideau Vets to say, how can we help to support our seniors in this community in Algonquin? We really want to be part of that with you. That's the message that we have been receiving on every single visit that we've had over the last 4 months. And I can't tell you how exciting that is for all of us. All of that, and I'm sorry, I'm ahead of myself. There are many aspects, and a key portion of some of the feedback as well is the role that nutrition plays in our health and well-being. And whether it was the City of Ottawa and the needs of young people and the number of people in our community who are going to food banks as their shopping center, shopping destination. It was amazing for me to see that. There are opportunities to partner. Again, as Claude mentioned, we've got our learning enterprises, which are student-led, and the possibilities of other enterprises coming, such as a physio, and then we'll have opportunities for our new occupational and physiotherapy assistant program. So tremendous feedback from the community and very supportive, all of which now leads to the academic response that we have that Jim's going to walk you through.
Thanks, Barb. Before we get going, I have two things to say. First of all, I've been involved very intensely in the last 13 months in this program. However, Michel Savard, my predecessor, did a tremendous amount of work before I took over his portfolio, and I'm trying to fill in his boots shoes. So I just want to acknowledge the hard work that Michel put in before leaving on this initiative. Secondly, when we're talking about the aging population and so forth, there might be a few people in here other than me who wears hearing aids. If you do, and you use size 312 in your battery, please see me after the presentation, because my batteries are almost dead. True. I was reading lips for half the time. Anyways, so back to the presentation. So how can we help? Our raison d'etre is really, we're an education institution. We can develop the human talent required to support these changing times. That's our raison d'etre. And serve really as a worldwide, we can talk about Ontario, we talk about Canada, but we can really serve as a worldwide model for community-based healthy living. Our vision that has been in formulation for the last 13 months intensely is really something that we feel is very compelling. A model, community-integrated learning innovation hub, addressing the skills and capacity needs of health, wellness, and long-term care, with a mission of helping Canadians live healthier lives. So this is an artist's rendering of what the possibilities could be. It really is an integrated health, wellness, and long-term care facility with the boulevard. We have the smart apartments. We have a healthy food cafe. We have a food research center. We have the simulation learning environments. We have co-located businesses. This is a tremendously exciting opportunity. And where do we find our role? We can either be let it happen or make it happen. We feel we fit right in the middle of that, of helping it happen, as our role in post-secondary education, serving the community, accelerating health and innovation to market, and creating authentic practice learning environments. So, in the next 5 to 8 years, we're going to have an enrollment growth of at least, hopefully, with really 2,000 to 3,000 students, and we think 1,100 of those will be related to the Healthy Learning Education Initiative. That's going to require a lot more square footage than we have now, up to 225,000 square feet. So that would be based on the 65 to 75 gross square foot per person. So that's a lot of space. And when we talk about an integrated hub, we have the learner in the middle of it, whether it's the business partnership with the co-located businesses to applied research. The Students Association has plans, perhaps you've heard, of building a triple gym. And so the recreation, health and wellness part of that, the wellness therapies, and in the center of that is the learner and the development. When you talk about the learning continuum with a healthy education building, you certainly have the enrollment, you have the academic side of things, you have the online, the face-to-face simulation, but really with having those co-located businesses on site, the learning enterprises, we can have them in simulation and practice here on campus before they go out into the community. So it really has the full practicum. And it's certainly, Mark Hodenbaugh's in the sense, the applied research is very important. So what kind of new academic opportunities are we looking at? There's a number of them from the Faculty of Health, Public Safety, and Community Studies, and certainly from the School of Hospitality and Tourism. But there are a wide range of interdisciplinary opportunities between the schools. I know in the School of Hospitality, if we're going to be doing a food processing technician program, we can't do that. We would be doing that with the Faculty of Technology and Trades. So that's something that there's a tremendous amount of opportunity. These are just some of the programs, and if you're in a faculty outside of health hospitality or outside of health and community studies, then if you have an idea, certainly talk to your chair and your dean. And certainly, the opportunity, and there's a need, and it's going to take a little bit of space. So between 130 and, as we said, 225,000 square feet, and the building right now is anywhere between $75 million and $100 million. So that is a big ask, and it's going to take a concerted effort with the politicians and also working with the community, and it's going to be it's something that the community needs. And we feel that we are well positioned to take advantage of it and provide that service to the community. So really is about the art of possibility. I don't know if you can see the larger one up on the right side, though, but there's an artist's rendition of what can happen at the corner of Navajo and Woodruff Avenues. You have the potential triple gym, and then you have where we had the phase 1 of HLE, where the massage therapy and the new AC salon, spa, and boutique are. If you haven't been there, you should check them all out. And then potentially 2 towers. There's And so it is a world of possibility. We're looking for your assistance, we're looking for your help and your ideas. And really, right now, we have an opportunity for question and answers. My hearing aids are still working, so that's good news. If I don't understand something, Barb, I'm going to just look at you to repeat it. All right. Thank you.
So we had a YouTube video as well, but I'm not sure. Are we showing that or no? Anyway, no. Okay, but you can Google that. There is a YouTube video on the HLE initiative. It recasts much of what you've heard this afternoon. So thank you, Barb, and thank you, Jim. So we will be taking questions at this point, and there are at least one mic. There are two mics. And so if, for those of you who have a question, if you can wait for the mic so that your question can be heard for our audience online as well. Anyone who's going to start us off?
Does everybody want to share what their blood pressure was?
They're well-fed, happy people.
They're
I
well-
know, this
That's
is great. This is great.
Is anybody enthusiastic like I am about this?
Yeah, I am. Oh, Sue.
Just a question about the smart apartments. Would those be seniors living in the smart apartments?
What it would be is an adult day program. So right now, for seniors who may need, families who may need some respite, and they have an adult day program where they would go 2 or 3 mornings a week, and then there would be activities for the seniors, and there may be certain therapies as well. And these are offered by Briere, for instance, and other long-term care facilities. And there's a huge need for these kinds of services and respite. And there also is opportunities then for us to better support families as well. And so we're working in partnership with Briere right now to try to facilitate that. They would run the program, but the program would be on our site. The opportunity for our students to engage, culinary students to feed them their snacks, the hairstyling folks to help. We have foot therapy. We have we've got so much here, and the opportunity for students to engage in this way. And this is just kind of opening the door a crack to how it could be if we had more of these kinds of enterprises. So we're very excited about that. But we're not offering them an overnight stay right now. But perhaps in the future.
And if I can add to that as well, one comment we had from our board last night is to think more broadly about the possibilities, as we've just heard. So as an example, aging in place will require that our current construction practices and design, so you think of interior design, you think of some of our programs in ACE, would need to adapt to recognize these considerations. So there are opportunities even for programs that you don't readily think of when you think of health and wellness to have a role to play within that broader umbrella. Yes?
What does the timeline for something like this look like?
We spoke about the need for space, and certainly if we look at the data that we've put together and that's been analyzed by our physical resources staff, by about 2018, 2019, we're going to need more space, simply as a virtue of our natural growth as a college. So that's about the time frame that we would want to have this in place, or at least a portion of this in place. In terms of the phasing in of what that would look like, that would hinge on the funding that we would be able to receive and the timeline associated with that. But what our best wishes would be to be able to start shoveling the ground and have something ready around 2018, 2019. Thank you. I think there was a question over there and then over here. Yeah.
That was my question, projected timeline for start and completion of the project.
Yeah.
Hi.
Hi.
Obviously, $75 to $100 million is a lot of funding. What are the main ways that you're going to go about getting that?
Well, there are multiple ways in which we can go about this. When we're exploring a number of options, that's part of what the advocacy is meant to do. As Cheryl mentioned, her meetings tomorrow, the meetings that we will be having over the course of the next year, the next 2 years, are meant to create that awareness with all our levels of stakeholders, and whether it's municipal, provincial, federal, and our community partners, wherever they may be, to elicit excitement, provide them with a compelling reason to want to be involved and participate in this initiative. There could be a number of ways. So it could be dipping in our own reserves internally, government grants. It could be a combination of those two things. It could be bringing in partners who would wish to locate with us. We talked about that in our boulevard of enterprises and services. So there are a possibility of having co-located businesses and tenants who would bring their own capital for infrastructure. And different manners of funding and financing. So we're going to look at all of those and determine what's best for the college and our community to move this forward. Okay. We have a question at the back.
Is it in the plans to have like a 3D prototype of the things made by the 3D printing of the whole project and the smart apartment, or?
It's a great idea. As we've done with all of our infrastructure projects, this will involve the whole of Algonquin and all of our communities as we continue to mature the process, the thinking, and the design. We're going to be inviting folks for information session, for focus groups, for charrettes, and there'll be opportunities to let our imagination be at play and create those kinds of maquettes. And for sure, 3D printing sounds interesting. Thank you. Yes.
Hi, Claude. You've done a great job addressing how this is going to be beneficial for the aging population in terms of seniors. What about the aging population in terms of kids? With the rise in childhood physical inactivity and the rise in childhood obesity, where is that being addressed in this new plan?
That's a great question. And because we have the continuum of programming here, we've got the Early Learning Center, we have the East Early Childhood Education Program, and interesting enough, we've started a first phase of that, Louise, in bringing our culinary students and working in the Early Learning Center and developing menus and actually providing food. So we're starting to create that momentum here already. And although we may have highlighted, the senior population just with the demographics, we really are looking at that continuum and the opportunities. Having an Early Learning Center here really provides us with that spectrum to think about how it starts right away and then continues throughout your lifestyle. I hope that answers your question.
I'm very excited about the possibilities it's going to bring to this campus. Are we looking at being able to develop things at our other campuses as well to be able to help ride the wave of the excitement that this is going to create?
I think that it transcends campuses. I mean, this is something where creating the environment for healthy living is going to be at the Woodruff campus, Perth, and Pembroke. And this is something that we will, over time, I think, transform our thinking about where we work, how we come to work, whether we walk or drive or bicycle, and we'll have the opportunity to create the environment which facilitates that. So the beauty of the lovely New Pembroke campus and the waterfront is, why would you get in your car, And so how can we translate whatever we do on the Woodruff site to our other campuses? Absolutely, and it's creating a different way of thinking about our own personal responsibility as we come to work and where we work. And so I see it just across all the campuses.
If I can add to this, we have a representation from HR on the steering committee, and the thinking is that it's not just programming and creating the workforce of the future for our health and wellness sectors, but also looking after ourselves as well from an employee perspective, employee health, employee engagement perspective. So further to what Barb said, we also see that dimension not just for the Woodruff campus, but for all of our campuses as well. Okay, I had Jeanette and then Wahab.
Mike.
Hi, Claude. I just want to know if you could provide us some information on job opportunities and job creations that this will bring, and also with the boulevard and all the businesses that are situated there, will our students be given priority or first priority or consideration for these businesses?
I'll take that one. Certainly, the infrastructure project itself will create jobs in the construction-related industries, and I know that the college has always been very keen to ensure that everybody that is involved in those projects employ apprentices, for instance. So, yes, there would be employment for people who either have graduated or are apprentices through trades that work on the project. And once the businesses are in place, it is our sincere hope that those would take our students either for work placements or upon graduation or as part of their work integrated learning opportunities. Absolutely. Thank you. Wahab?
Thank you. I think, education and health are the main pillars for the economy. So having healthy people and very qualified, educated people is the force to move forward. I noticed one of the slides that there is, it will be a worldwide model, as Jim mentioned. I'm just wondering how the digital technology will be implemented in this learning center. Thank you.
And that's a great question, because essentially those digital technologies underpin the whole initiative. And I'll give you an example, Wahab, of some work that's being done as we move into the smart apartment, and working with our university colleagues to have sensors in the floors, on the walls, so that they can anticipate, seniors' gaits and potential falls and those sorts of things, and they're collecting data. So we're putting the technologies in place to help support those research innovations, and we're creating those opportunities here. The digital apps in healthcare are huge. And one of the suggestions is there's many, but do they connect with one another, and how does that information come together so that people can make some decisions? So the opportunities to really play in that space, in these environments. Again, often healthcare and education are the last to really embrace some of those new initiatives. And I remember I had a colleague, a medical colleague, who said to me, Barb, that you don't need a chart anymore. I wanted a chart. I wanted a paper copy of a chart. And they said, that's not there. You have to engage in a different way with that information to be able to care for your patient. And I just was really having trouble with that. But that's the kind of the climate that we're going to be able to educate our students in. It's just going to be their second nature will be the digital world that they interface with. And I'll want the chart. And Mike.
Thank you for having this information session for us. It's great to be involved and to hear it firsthand from you guys. My question is, when we start developing the landscape of the labs and rooms and hallways and storage, will you be asking the employees who are daily involved in these labs and rooms to ask for their input on how things should be situated and where doors should be and certain units for mechanical and whatnot for each of the labs that will be developed?
Mike, I can tell you, you are going to be one of the pivotal people, and your team. For those of you who don't know Mike, Mike is our technologist in the nursing and health area, and Mike has lived in a fairly confined space for a period of time. And bless his heart, you know, the labs are set up and magic happens. But you know, are the doorways going to be big enough to get the stretchers in? I mean, these are questions that are just, you know, you have the building built and you think, oh, why didn't we think of that? So absolutely, Mike. I mean, the input from everyone, you know, all of the staff at the college is going to be key as we build this. And we'll go through various iterations as we move forward. But I know that you've been thinking for a long time about this, and so you're absolutely, and your team is on the list for sure.
So I have time for one more question, and then we have the video we can show.
As a staff member, I know a lot of people who visit the campus have a hard time navigating around the campus, especially finding a building. It's full stairways, it's not well navigable anybody with a disability. I mean, I guess that'd be one of our major things we have to do, is how to get people from the transit way and from parking into this new building and reorganize this mishmash of buildings we have here.
I agree. I think the wayfinding is paramount, especially for people who don't know the college well, our layout. And I think it's a testament to our physical resources folks and the people with whom we do business when we design our new spaces. We make it much more open, much more visually intuitive for one to orient oneself. And so I'm without a doubt, I know that we'll continue to improve wayfinding and ensure that the new facility follows in those footsteps. So thank you for your comment.
We have hired the B building architect to do all that design. So I couldn't help myself. It was too. Yeah.
Okay, so you have the video, Doug?
Yep.
All right, so before we go to the video, because I'm not sure I'll have another chance afterward, we'll watch the video, and after that, I know some of the exhibitors are still around, and they will be around until 1:30. So you're welcome to stay and continue to have conversations with the exhibitors. I want to thank a few people, because making an event like this doesn't do itself by itself. Christine Brennan, Joanne Del Duca, and Phil Gaudreau. Thank you. So we'll roll the clip now. Thank you.
Imagine a place where the classroom, the research lab, and the workplace are integrated. Where living in a healthy, sustainable way is fully supported. And where healthcare transformation is real and being lived every day. That's the Healthy Living Education Initiative, Algonquin College's vision of a community-integrated learning and innovation hub that will address the skills and capacity needs of our health and wellness sectors. The way we deliver health and wellness care is changing. It's moving into the home, into community clinics, and online. Healthcare is becoming more innovative through technology, through wearable technology, smart gyms, and digital tools. We are becoming more aware of our own health needs, the importance of eating the right foods, performing the right exercises, taking the right medicines, and managing chronic health problems before they happen. And at the same time, Canada's population is aging. An entire generation of nurses and other seasoned healthcare professionals is retiring, and yet we will always need hospitals. Our healthcare system is changing, and the skills needed by tomorrow's healthcare and wellness workforce are changing too. Algonquin College is ready to be a part of the future of healthcare. As an integrated community learning and innovation hub, Healthy Living Education will lead advances in simulation-based learning through student learning companies, work with community businesses and partners on campus to enhance health outcomes, innovate using digital technologies for efficient delivery, and become a specialty simulation center with flexible learning spaces and living labs. Sustainable health is about more than just healthcare. It requires significant changes to our existing model of overall well-being. By closing the gap between education and practice, we can produce healthcare professionals dedicated to resolving the impending worker shortage and committed to easing the shift from a hospital-based healthcare system to a system that is community-based, prevention-focused, and patient-centered. New programming will cut across sectors in areas such as health sciences, community-based services, food and nutrition, digital health, and paramedic education that addresses current and future gaps. Our vision for the Healthy Living Education Initiative provides the right health and wellness services at the right time and in the right place. Visit algonquincollege.com/HLE to learn more about how Algonquin College wants to help Canadians live healthier lives.